Hi everyone. I thought today we'd have a look at a research paper that discusses the use of alfaxalone intravenous anesthesia in moderately unwell patients. The title of the paper is Clinical Efficacy and Cardiorespiratory Effects of Alfaxalone in Comparison to Diazepam, Fentanyl and Propofol for Induction of Anesthesia in Dogs that are Poor Anesthetic Risk. It was published in 2011 and the researchers were from the Queen Mother Hospital at the Royal Veterinary College in Hatfield in the United Kingdom. The objective of this study was really to evaluate the clinical efficacy and cardiorespiratory effects of alfaxan as an anesthetic induction agent in dogs with moderate to severe systemic disease. It was a randomized prospective clinical study involving 40 dogs, all with ASA classification of 3 to 5. Now, the procedures that were being undertaken under anesthesia were quite varied, generally involving thoracic or abdominal surgery. Examples of the abdominal surgeries that were undertaken included adrenalectomy, exploratory laparotomy, gastropexy, management of GDV, partial pancreatectomy, splenectomy, and insulinoma removal. For thoracic surgery, the procedures included exploratory thoracotomy, lung lobectomy, pericardectomy, and rib removal. There were some other procedures involving balloon valvuloplasty and pacemaker implantation for cardiac surgery, and some miscellaneous surgeries, including neck exploration and total ear canal ablation as well. All dogs in the study were premedicated with methadone at 0.2 milligrams per kilo and were subsequently randomized to receive either alfaxalone induction or an induction protocol involving fentanyl and diazepam supplemented with propofol to facilitate endotracheal intubation. Following induction and intubation, patients were maintained using a combination of isoflurane inhalant anesthesia and fentanyl continuous infusion. By way of context, estimates of mortality in ASA 3 to 5 classes in dogs are about 1 in 75 patients, with about 6% of those patients dying either at induction or shortly thereafter. Previous studies on the use of alfaxalone in healthy dogs indicate that it does produce dose-dependent decreases in both blood pressure and cardiac output, and a dose-dependent decrease in respiratory rate shortly after induction in unpremedicated patients. Now, the results of this study showed that heart rates were similar both prior to and following induction in both groups of dogs. There were occasionally significant decreases in systolic arterial blood pressure in some of the dogs in the alfaxalone induction group, and increases in heart rate in, again, some of the dogs in the alfaxalone anesthesia group. And these increases in heart rate were also associated with increases in systolic arterial blood pressure. Whether or not this change had something to do with the underlying reason why these patients were anesthetized was not made clear in the paper. Apnea was not observed in either group, and anesthetic induction typically took around 1 minute, indicating that relatively slow intravenous induction techniques may not lead to significant changes in respiratory rate in patients that are induced with either of these protocols. The conclusions of the researchers were that alfaxalone resulted in a smooth induction of anesthesia, and the cardiorespiratory effects were reasonably minimal both at immediate post-induction period and during subsequent maintenance of anesthesia with isoflurane, and these changes were similar to those that occurred following administration of fentanyl, diazepam and propofol. Arterial blood pressures were preserved equally with both induction techniques, with perhaps the exception of the occasional patient that seemed to display an alteration in heart rate and systolic arterial blood pressure. So the overall conclusions of this study was that alfaxalone was a clinically acceptable induction agent to use in dogs that presented with moderate to severe systemic disease. The clinical usefulness of this study centers around our ability to potentially use alfaxalone in compromised patients that require general anesthesia to assist in either diagnostics or resolution of the patient's underlying disease. Well, if you'd like to find out some more about anaesthesia in emergency and critically unwell patients, join us at Vet Education for a 4-week online interactive course starting October 9th, 2017, where we'll dive into more anaesthetic agents. We'll talk specifically about analgesia in these patients as well, and cover how to develop safe and effective anaesthetic protocols for patients with diseases ranging from gastrointestinal disease, respiratory disease, neurological disease, among many others. Visit our website www.veteducation.com.au and click on Vet Courses for more information.